Welcome back to What You Will Learn. My name is Adam Ashton.
And my name is Adam Jones. Today we are doing Unconventional Medicine. Join the revolution to reinvent healthcare, reverse chronic disease, and create a practice you love by Kresser.
Mate, so we heard Chris Kresser on Joe Rogan. He did 2 big episodes and it was pretty sick, man. Just a very different take on healthcare. And we thought we should check out his book and get him on.
Yeah, so in the book, we didn't realise when we first bought it, it's probably... The audience is probably people in the medical kind of profession or the health profession.
Yeah.
However, there's a lot of awesome cream in there.
Oh, definitely. I'd say for us, it was probably 40 to 60% relevant, but there's some good shit in here that we'll dig out, that's for sure.
Yeah, and it's definitely unconventional, so it digs into a bit of the conspiracy shit.
Yeah, which we love. We absolutely love.
We love the conspiracy.
Mate, so chapter 1 starts with Leo's story, a call to action. He talks about this little kid who's just an absolute little shit. And he basically just always threw tantrums. He flew off the handle whenever there was any change in his life. He basically just sounds like he just ate potato chips and Fruit Loops and stuff and wouldn't eat any veggies, and eventually went to a doctor, and the doctor said, hey, take some Adderall, whatever medicine, which worked a little bit, but it caused him constipation and sleep problems. So they gave him another medicine, and then there were some side effects from that. So they gave him another medicine and basically just kept feeding him drugs, which was just... shit ass. Yeah. That's not a good solution.
Yeah, that's it. So, that's what we'll get into that as well. That's what our current conventional medicine paradigm's all based on. It's like he says, it's kind of like whack-a-mole. We'll have like some kind of symptom for one problem like Leo did, and then they just kept feeding him drugs, and then more problems popped up, so then they gave him more drugs and so forth. But then he went and eventually saw Chris Kresser. And it turned out to be something, a really simple diet changes.
Yeah.
So this whole time he's been taking drugs, and he was probably, destined to take these drugs for the rest of his life. But if someone looked at it holistically from the functional medicine point of view and just simple diet changes, he wouldn't have had to have any of it.
No, exactly. And that's the big difference that Chris Kresser talks about. So chapter 2 is from Band-Aids to true healing. So obviously the drugs are just Band-Aids, whereas he talks about the true healing. So he talks about an analogy later in the book, or a metaphor about a boat with holes in it, and you keep trying to bail water out with a bucket, but more water keeps pouring in and more water keeps pouring in. And one solution is to get a bigger bucket, but that's not too good. The ultimate solution is just eventually plug the holes, and that's what we want to be doing.
So he says most people don't realise the sheer scale and urgency of the crisis we're facing.
Yeah.
We've reached this inflection point where we cannot afford to act on a massive scale, and he goes into healthcare costs later about what's on the horizon. But the action must not come out of the same system that caused the problems in the first place. Yeah,
no, that's very true, and that applies to everything. And that he talks about how insanity is doing the same things over and over. So you need a new approach from a new perspective. And
this perspective, which he's trying to design in the book, and he's trying to really cause a revolution in the way, proposing this kind of adapt framework, he calls it.
Yeah.
And this is trying to design a healthcare system that prevents and reverses chronic disease instead of managing it.
Yes.
Offers inspiring, meaningful reward to the doctors and practitioners, uses health coaches, nutritionists, and allied providers, so like a whole team of healthcare providers, and reduces the costs of healthcare of governments, organisations, and individuals. So that's the goal of his framework.
Yeah, nice. As you said, it's sort of like part book, but also part just call to action to get other people to get behind this concept. And he talks about chronic disease. So he says it's a slow motion plague that is sabotaging our health, destroying our quality of life, shortening our lifespan, bankrupting our governments, and threatening the health of future generations. We can no longer afford to not take action on a massive scale. And he talks about this chronic disease. It used to be the top 3 causes of death, like 100 years ago, were just random acute infectious diseases that are, like the plague and shit, on a smaller scale, perhaps. But now it's just 7 out of 10 are chronic diseases that are just long-term build-ups that are as a result of things that we can actually change if we got started earlier.
Yeah, that's right. So in the 1900s or early, all medicine was based on this kind of acute kind of diseases. So this is what conventional medicine came out of, and this has done some fantastic things for everyone. So antibiotics revolutionised the treatment of infections and trauma, injuries, and bacterial and parasitic pathogens. Anesthesia made it possible to perform surgery without fucking going through absolute agony. And antisepsis, which is like sterile surgical equipment, greatly increase the rates of survival from procedures. So we've got a lot of gifts out of this conventional medicine.
Yeah,
but
it's some good stuff.
But as I was saying, it's kind of like whack-a-mole. It doesn't really help chronic disease. Chronic disease is something that obviously that is going to be huge.
Yeah, and he says that, I think are we sort of moving into part 2, which was the problem. And chapter 4, he says chronic disease, slow motion plague. He says 1 in 2 Americans have a chronic disease. 1 in 4 have multiple chronic diseases. He says that the US spends $3.2 trillion on healthcare every year, and worldwide healthcare spending is projected to hit $47 trillion by 2030.
Mate, that's unbelievable.
I don't even know what that number is. 47 trillion.
That's a lot. So yeah,
it is a lot.
Yeah, it accounts for 86% of healthcare expenditure and 99% of Medicare dollars.
Yeah,
mate, it's unbelievable. 1 in 2 Americans have chronic disease.
Yeah, that's a lot. And he says 1 in 3, 2 in 3 have diabetes or pre-diabetes,
and 27% of children now suffer from chronic disease as well, up from 13% in 1994. So it's undoubtable that it's coming.
Yeah,
and it's growing, this trend.
Oh, definitely.
He says if you look at a photograph of people in the 50s and 60s, you'll notice that they just look completely different. Their obesity was rare, and they look just genuinely healthy.
Yeah.
But today you look around and we're kind of used to now 2 out of 3 people just being fucking huge, and fat and walking around with a can of Pepsi or Dr. Pepper and Pringles.
Yeah. So he says there's 3 reasons that we're absolutely destined to fail, that we're just on this collision course. Essentially, the first one is that our modern diet and lifestyle are way out of alignment with our genes and biology.
And he uses this football field analogy, which represents human history. And the first 99.5 yards out of 100 represent our time as hunter-gatherers. And the last 0.5 yards represents the time since agriculture was developed.
Yeah.
And then the Industrial Revolution only came in the last few inches.
Yeah.
Mate,
crazy.
So our diet today, our top 6 foods in the American diet, it's fucking... And when we say Americans, probably the same in Australia.
Yeah.
But number 1, grain-based desserts. Bread is 2. 3, sugar-sweetened beverages. 4, pizza. 5, alcohol. 6, chicken, not like good chicken, but like chicken nuggets.
Chicken nuggets, which is not chicken. And obviously when you contrast that to back in the old days, when they mostly ate meat and fish that they'd run out and catch, they'd eat wild fruits and vegetables, a few nuts here or there. There's no Doritos, there's no soft drink, there's no Maccas, there was no ice cream, any of that stuff. So
that's diet. Another point under the modern diet and lifestyle is lifestyle, and there's a mismatch between our evolutionary history and our modern environment. And he talks about this light and dark cycle that all organisms have on the planet.
Yeah, so obviously we always used to, before there was electricity, when the sun came up, we woke up. When the sun went down and it got dark, there was nothing we could do, so we went to sleep. And that's pretty much how we've always been and how we should be. But now we've got artificial light, so we can do whatever we want. We work night shifts. And we're basically just always fucking around with our natural circadian rhythm.
Mate, people who, say, work in the office, they get up really early. They might leave to work in winter before the sun comes up.
Yeah.
They probably work till, the
inside
sun goes down.
In the office,
and they don't see... And then they eat their food at their desk at lunch.
Yeah.
Don't see essentially any sunlight at all.
Exactly. So he gives us 3 quick solutions here just to this short issue. Don't use electronic devices in bed before you go to sleep, because that seriously throws your whole... serotonin and melatonin out of whack. 2, avoid doing night shift, or if you do work night shift, at least do permanent night shift. Don't do rotating day-night. And 3 is get some exposure to bright sunlight before you get to work to wake you the fuck up.
Yeah, that's it. Another one, man, is behaviour. So again, from the evolutionary perspective, we were like these hunter-gatherers roaming around, hunting deer, fucking running away from lions. Today we're just sitting at a desk.
Exactly.
Just,
and
punching away.
There's more and more info, I think, coming out that sitting is just so bad for you. People say sitting's the new smoking. That he compares like a marathon runner. So if there's a marathon runner who's an office worker, so they sit at their desk for 8 hours a day, then they go home and run 20 or 30 Ks, that person is at a much, much, much higher risk, even though he's getting so much exercise, because he's sitting so much. Compare that to someone who's like a manual labourer who's up and about working all day.
That's it. The next one, our environment has changed, but our behaviours have not. So in the past, through evolution, we've been programmed to seek out high-calorie, rewarding foods. Today, our environment has changed, where we can just go to 7-Eleven and get these highly dense calorie foods.
Yeah.
But eating potato chips is rewarding, but makes us want to eat more.
Because we grew up in that scarcity of food. There wasn't always, as you say, a 7-Eleven on every corner that you can just go and get a packet of chips or a Slurpee. It used to be that, you'd have to go work for your food and eventually get a big kill and then feast for a while. So we're always starved. We're always sort of lacking in food, whereas now there's food everywhere, but our body still thinks that we're lacking. So it always holds on to everything we get.
Mate, that's it. So that's the first reason our healthcare is doomed to fail. Our modern lifestyle and diet are out of alignment with our genes and how we evolved. Mm-hmm. The second one is we have the wrong medical paradigm for chronic disease.
And he calls it the rock in the shoe mentality, whereas the conventional medicine is if someone's got a rock in their shoe and they say they've got a sore foot, the doctor probably gives them an anesthetic injection so they don't feel the pain of the rock in the shoe. Whereas Chris Kresser says, why don't you just take your shoe off and take the rock out, and then you're all right.
Yeah.
So it's a completely wrong approach.
Different. So the wrong paradigm completely. So today's patient has multiple problems, sees multiple doctors, and requires multiple treatments. And the big thing here is the average appointment is 10 minutes. And that's pretty much only enough time for a doctor to have not really even listen to him, but just prescribe something.
Yeah, it's like, cool, you got a headache, take some Panadol.
Yeah.
Whereas it's not like, oh, you got a headache, oh, maybe it's because you got poor posture and your neck's out of whack. It's just like, what's the main problem, and we'll give you some kind of medicine.
So again, it's not the doctor's fault here. It's just the actual system's kind of flawed.
Yeah.
So that's the second reason why we're cooked. The third reason why we're cooked is we have a healthcare model that doesn't support preventing and reversing disease.
Yeah. So as you say, we sort of need someone who knows a lot of stuff, or at least, it's not like you go to one specialist and then they say, oh, you need to go see another specialist. We'll book you in for 3 weeks later. It just doesn't make sense. It's not effective. It's not quick. It's just a long, drawn out, shitty, expensive process.
And one of the big pieces of support patients need and doctors need is help give the behavioural changes needed for a lot of this. And at the moment, it's none of it's based on behaviour. It's just based on what drug can I just...
Yeah, it's just all short-term, fix the problem as quickly and easily as possible. There's no long-term actual fix addressing the root cause.
Yeah, that's it. So, man, the next part of the book is part 3, the solution.
Yes.
Which is good.
Yeah, that's what we want, obviously. Yeah, so he said, so there's 3 bits. So the paradigm shift, a bit of a realignment, and a collaborative model.
Yeah. So functional medicine, so the ADAPT model he's providing has 3 elements. The first one is functional medicine, which is preventing and reversing rather than managing chronic disease. Number 2 is an ancestral diet and lifestyle, which reflects how we evolved. And 3, a collaborative practice model where they're all teaming up, doctors, coaches, and dietitians and everything.
Yeah, nice. So the first one is this functional medicine that we've sort of been touching on as we go. But he's got a diagram, like a bullseye, concentric circles. The very outer ring is the signs and symptoms. The next one in is diseases and syndromes. The next one in is pathologies. And then the very middle is exposome, genome, and epigenome. So basically the conventional medicine starts from the outside, works their way in. They probably look at the signs and symptoms, and then they get to the disease and syndromes. That's pretty much where they stop. Yep. Whereas functional medicine says start at the absolute center and slowly work your way out.
That's it. So the center is kind of like a root cause, which you kind of need a bit of digging to get there.
Yeah.
But there'll be some kind of cause that causes the disease and symptoms.
Yeah.
And then at the end causes the diseases and syndromes, which causes the signs and symptoms.
Yes, exactly. Going from the inside out as opposed to the outside in. I guess a few quick definitions. A disease is defined as a disorder of structure or function that produces significant signs and symptoms, whereas a syndrome is like a group of signs and symptoms that go together. So he says like irritable bowel syndrome or restless leg syndrome, you get a whole bunch of stuff going together, whereas a disease is like Alzheimer's disease, rheumatoid arthritis.
Yeah.
And then signs versus symptoms. Signs are objective, so things that a doctor can clearly see and diagnose, whereas a symptom is subjective and it has to be told by the patient.
Yeah. So if you get to the very core, like the very root cause of a lot of the problems, what's happening, it's a combination of our behaviour, environment, diet, lifestyle, air, water quality, toxins, social environment, family environment, and so on. So these are the very core roots of a lot of the problems.
Yeah, nice.
And you move out a bit, again, you got pathologies, which is things such as gut infections, parasites, bacterial infections, and these are the things that form the diseases. And then now we're at the disease level where the pathology, the environment causes the pathologies, and the pathologies causes things like type 2 diabetes, Alzheimer's, celiac disease, arthritis. And then the next outer ring on the circle is the signs and symptoms where, you've always got headaches, you're always hungry, you're always thirsty, cholesterol, all that kind of jazz.
Yeah, nice.
So another part of this functional approach, he talks about being patient-centered versus doctor-centered. So if you see someone who believes in the functional way of medicine, if a patient wants to overcome chronic disease, they must shift their behaviour. It's on them. It's not on the doctor to cause a solution. It's back on the person, and they got to take some responsibility for why they're fucking 130 kilos. And
it's important to take some control rather than just saying the doctor saying, here's the drugs, take these and you'll be fine. You got to actually make some lifestyle and dietary changes, not just band-aid approaches.
So the conventional doctor so the patient will see the information passively and go, help me. And then they just get, and these pills get thrown out.
Exactly.
And they're on fucking prescription drugs the rest of their life. Yeah. Chapter 9, he talks about there's a realignment, matching our environment with our genes.
Yeah. And he talks about we need to go back to this ancestral diet and lifestyle. So as you said, 10,000 years we were living one way, and then in the last, not so long, couple hundred years, we've gone agricultural revolution, industrial revolution, and completely changed all the things that we sort of talked about throughout. So we need to sort of somehow get back in touch. Our genes haven't evolved as quickly as our environment has changed. So we need to take a few steps back and get back in touch with the old school.
And Chris loves the paleo diet, but he knows, paleo diet gets a lot of shit. Yeah. But he says don't look at it as if at like what they ate, because there was a lot of different paleolithic cultures all around the world, and some had a high percentage of meat, some a high percentage of sweet potato. So they're all kind of different. But it's a better paradigm to look at what they didn't eat.
Yes.
And what they didn't eat was the top 6 food sources I mentioned earlier. Pizza, beer,
all that shit
chicken.
That didn't pretty much if it didn't exist 100 years ago, if they've just made things like Pringles and ice cream and stuff, it's probably not good for you. But I like how he says that he follows pretty much a paleo sort of diet, but he hates paleo because it has got so much stigma attached and so many fucking idiots who are just pushing it too hard or don't really know what they're talking about. They just grab a few headlines and try and push that on people, whereas he says, most of the stuff they're saying is good, they just do it in the wrong way.
Yeah. So chapter 11, as we're closing up the book now, regarding evidence. So a lot of people, when he presents his case of functional medicine, people go, there's no medicine, there's no evidence for this kind of stuff, Chris. But he says many people don't realise that conventional medicine, a lot of the peer-reviewed research and things like this are pretty flawed as well in the first place.
Yeah, definitely. And part of his solution in terms of the actual treatment of applying this functional medicine stuff we've talked about is the collaborative model of having smaller, he calls them micro practices. So not like a big doctor where there's 20 doctors in the room, there's 100 people in the waiting room and they're going in for 8 to 12 minute in and out. He says you need, independently operated micro practices that are lean, they've got longer appointments, limited patient count, and a true connection with patients and true healing. So it's obviously it's a utopia, but we need to be heading more towards that direction.
Yeah. Mate, just an interesting one on the evidence side of things. He says there's been occasions where a researcher falsified a lab test to hide a patient's impaired kidney and liver function. So they're doing, falsifying test data that went into peer-reviewed research on two chemotherapy patients or something on the new drug they were testing. So one person died from this.
Yeah, far out.
The researcher was sent to prison, but in all the studies, in the peer-reviewed research, this wasn't mentioned once. This was completely hidden. And even though there was court documents with the falsification of data, that's crazy.
Now, there's a massive... the issue there, I think, is a misalignment of incentives, and also that most of this research is being funded by pharmaceutical companies that obviously want their research to get through. They want the researcher to say, this drug's good, so that they can start selling the drug. And obviously, if someone dies from it, that's probably not good for sales.
Oh, totally. Man. That's a good segue into the next one as well. So if a bunch of studies that were all peer-reviewed research, so-called. Another person went out there and tried to replicate the results with the same conditions and the same kind of studies. So if it's peer-reviewed, you'd think it'd get the exact same kind of output. But they found that 75% of them could not be reproduced.
Oh, Jesus.
So that's, mate, 75% of the research.
That's high. That's extremely high.
And another study of cancer research found that only 11% of the preclinical cancer research could be reproduced.
Jesus, that's fucked.
11%.
That's extremely low. Mate, some other issues is that insurance companies are the ones paying for all this healthcare. And really for insurance companies, it's not in their best interest for you to get healthy and stop paying for insurance. So Chris says a bit conspiratorial is that they want you to be less healthy longer term, so that you have to keep paying.
Well, they get paid by people being unhealthy.
Exactly.
So do the pharmaceutical companies. So again, it's the incentive misaligned.
Yeah.
And it might be a bit of that corporate structure. So maybe listen to the corporation and our interview with Joel Kevin Bacon.
Yeah. Exactly.
So in closing the book, man, the transition, he says, all truths pass through 3 stages. And this was by a big philosopher who said this, I forget who. But first, it is ridiculed. Second, it's violently opposed. And third, it's accepted as self-evident.
Yeah, nice. And then that reminds me of I don't know if it's in the book or not, but about the guy who talked about germs, the germ theory, about how doctors, if they just done an autopsy on a dead body and they go to a woman giving birth and the baby dies, or the mum gets an infection, he's like, maybe there's like these invisible things that we can't see that we're transferring from the dead body to the person. And basically, he got locked up for being a crazy person. And that's sort of the first stage of what you say of being ridiculed and violently opposed, until eventually people realise maybe there's something to it. And they realise that actually if we wash our hands, then people get less infections.
Mate, unfortunately for a lot of these kind of dudes, they're violently opposed in their lifetime, and then they die. And then 100 years later, they don't see their... They would have been absolute kings.
Exactly, man.
Dead by the time it's accepted as self-evident.
Just died in prison. Poor bloke.
Just get burned at the stake.
Yeah, exactly.
By the church or something. So, yeah, man. Unconventional Medicine. Good book, man. There's some cream in there.
I think if you're a doctor and you're in the conventional medicine, I reckon have a read and open up perspective a little bit. Join
Chris' paradigm, because a lot of these kind of things, it's probably, reading this book, it's an inevitable trend that it's going to have to turn toward functional, just because the conventional way, it's not working. And the cost we mentioned earlier, that's also a trend as well. So with the conventional system, I think it's going to be a very high proportion of GDP just managing these chronic diseases.
Yeah, it's crazy.
And we've got an aging population and everything, so
it's only getting worse.
It's only getting worse. So get out there and get functional.
Yeah, mate. So we'll speak to Chris, get a bit more info. I'm looking forward to that.
Yeah, get a bit
He's
of
got some
conspiracy
good shit to say.
Yeah.
Herb quit smoking with Chantix and support. Talk to your doctor about Chantix and a support plan that's right for you. Some people have had changes in behavior, hostility, agitation, depressed mood, and suicidal thoughts or actions while taking or after stopping Chantix. If you notice agitation, hostility, depression, or changes in behavior, thinking, or mood that are not typical for you, or if you develop suicidal thoughts or actions, stop taking Chantix and call your doctor right away. Talk to your doctor about any history of depression or other mental health problems, which can get worse while taking Chantix. Some people can have allergic or serious skin reactions to Chantix, some of which can be life-threatening. If you notice swelling of face, mouth, throat, or a rash, stop taking Chantix and see your doctor right away. Tell your doctor which medicines you're taking, as they may work differently when you quit smoking. Chantix dosing may be different if you have kidney problems. The most common side effect is nausea. Patients also reported trouble sleeping and vivid, unusual, or strange dreams. Until you know how Chantix may affect you, use caution when driving or operating machinery. Chantix should not be taken with other quit smoking products.
The urges weren't like they used to be, and that helped me quit.
Talk to your doctor to find out if prescription Chantix is right for you.